The nose is the only externally visible portion of the respiratory system, but its importance is far exceed its size. It represents the first line of defense against particulate matter and temperature extremes. The paranasal sinuses, while often clinically overlooked until inflamed, significantly contribute to air conditioning and resonance. The nose is far more than airflow. It filters particulates, warms air via an extensive vascular network, humidifies it through mucosal secretions, and houses olfactory receptors. The nasal cavity also functions as a resonating chamber for speech, illustrating how airflow dynamics influence vocal quality. These functions become clinically relevant in chronic rhinitis or in structural obstruction. The external nose is supported by both bone and hyaline cartilage, allowing rigidity where protection is needed and flexibility where airflow dynamics change. The ali maintain patency of the nares during inspiration, a feature that becomes obvious in conditions causing increased work of breathing, such as nasal flaring in respiratory distress. Internally, the nasal cavity is divided by the septum, and it's composed of both cartilage and bone. The roof's proximity to the cribriform plate explains why severe facial trauma can result in CSF or cerebral spinal fluid rhinorrhea. The hard and the soft palate form the floor, separating our respiratory and our digestive pathways while still allowing for coordinated swallowing and breathing. So you're not breathing while you're swallowing, vice versa. The nasal vestibule acts as a coarse filtration zone. Um, it's lined with vibrissae, which trap large particles before they reach delicate respiratory epithelium. And this region transitions from skin-like epithelium to respiratory mucosa, reflecting its dual protective and conductive roles. The nasal cavity contains two specialized mucosae. Olfactory mucosa supports chemoreception, while respiratory mucosa support particle clearance and humidification. Goblet cells and seromucous glands produce mucus that traps particulates and contains antimicrobial enzymes. This is an early component of our innate immune system or our innate immune defense mechanism. Our nasal concha dramatically increase surface area inside the nose, and they also induce turbulence. This slows airflow to maximize its contact with the mucosa. The turbulence is not inefficient, it's essential for warming and humidification of air. Loss of turbinate structure, such as after aggressive surgery, can severely impair nasal function. During inhalation, the concha are optimizing air conditioning, and during exhalation, they reclaim heat and moisture. This conservation mechanism is particularly important in cold or dry environments and reflects the system's efficiency in minimizing water and heat loss. The paranasal sinuses reduce skull weight and they contribute to voice resonance. They also assist in air conditioning. Their mucus drains into the nasal cavity, a process dependent on ciliary function. And when drainage is impaired, as in sinusitis, infection risk will rise due to stagnant secretions. We'll stop here. When we come back, we're going to look at the pharynx as our next component of the upper respiratory system.